Since almost a third of our employee accidents are back and shoulder injuries, we will examine ways you can improve the health and fitness of your back and what steps you can take to avoid a potential back injury. Let's face it, no one wants to experience a back injury. Back injuries are painful, debilitating, and can take a long time to heal. A back injury affects every aspect of your life, both on and off the job. However, by following the procedures outlined in this video, you'll be doing your part to reduce back injuries. Preparation, technique, and fitness are key. They are in fact the primary factors in prevention of on-the-job back injuries. To keep your back strong and healthy, you too must approach your work with a certain attitude, because if you don't, chances are you could become a statistic, one of 70 million Americans who suffer lower back pain. Lifting, bending, stooping, pushing, pulling, handling, and carrying objects of varying sizes, shapes, and weights is inevitable. Yet, despite the statistics, back injuries can be reduced or eliminated by using the principles of preparation, technique, and fitness. Let's take a minute to discuss the anatomy of your back. This knowledge will give you an understanding of how your back works, so you can make better decisions about how to lift anything. The human spine consists of 26 bony vertebrae, each of whom is separated by soft discs that absorb the shock of movement and impact. The most common location of a back injury is the lower lumbar region, where the greatest force occurs. When the spine is bent and placed under the stress of weight, pressure is exerted unevenly on the discs and on the back muscles. When the spine is kept erect during a lift, the lifting force is distributed evenly over the discs. Poor posture, an unhealthy back, and improper lifting techniques can, over a period of time, lead to degeneration of these discs. This condition is permanent and can have painful and lasting effects. Nerve roots branch out from the spinal cord and go to different parts of your body. Improper lifting can also pinch, irritate, or damage these nerves. There are muscles and ligaments in your back that stretch and move as you lift. These too can become damaged or torn from improper lifting techniques. However, even though the back is a complex and delicate structure, there is really no excuse for a back injury. Lifting is done according to the lever principle. When a lift is performed correctly, the ratio is an even 1-to-1. When you lift incorrectly by bending at the hips and lifting with your back, the ratio increases to 10-to-1. This means 10 times the strain is being put on your back. If your back is bent and your arms are extended when you lift, the ratio is even higher. When lifting in this manner, you not only have to lift the object's weight by 10, but also your upper body's weight times 10. Keep your ratio at a safe even 1-to-1, and always lift correctly. A commitment to regular stretching exercises before work or any time during the day after long periods of sitting, either in chairs or in your vehicle, can pay a lifetime of dividends. The best way is to stretch each major muscle group, especially the backs of your legs. Always move slowly and smoothly when stretching. These simple stretching exercises can provide a safety margin for strains and sprains. With one leg in vertical standing position, step back with the other leg and place your foot flat on the ground. Hold this position for a few moments. Then repeat with your other leg. Next, slowly bend over and come as close as you can to touching your toes without straining your back. Keep your legs straight. Hold this position for a few moments to get a good stretch. To stretch your back, raise your arms over your head and stretch your arms upward as far as you can. When you spend long periods of time in a sitting position, whether at your desk or in your vehicle, muscles in the back of your legs can tighten and cause undue stress on your back when bending. To keep these muscles loose, a good habit to get into is to sit on the floor with your legs straight for about 15 minutes each night, with your back up against a firm surface such as a sofa. This exercise will stretch the muscles in the back of your legs and provide additional flexibility, taking some strain off your back. Now that you've warmed up, let's talk about safe lifting techniques. To lift safely, first size up the weight of the item you're going to lift. If you feel the item is too heavy or awkward to lift by yourself, ask someone for assistance. Know the path you will take after you lift the item and where you will set the item down. Place your feet close to the item with your feet about a shoulder's width apart. Bend your knees and squat down close to the object. Get a firm palm grip on the item. Hold the item close to your body and then stand up, keeping your back as straight as possible, using the muscles in your legs, not your back. That's the basic safe lifting procedure, and it does work. But you're not always just picking up a box. Your job presents different lifting challenges, each requiring your attention to the safe lifting techniques described above. But remember, the weight of an item is only one component. You can injure your back when lifting something as light as a pencil if you do it incorrectly. When you bend at the hips to pick up anything, you're not only lifting the object, but also your upper body weight, times 10. Bending over, reaching, or twisting your back regardless of load can lead to problems. Never reach or twist when lifting anything. Instead of twisting, lift the item, pivot your feet, and then set the item down. It doesn't take a lot of time, and it does help to protect your back. Slips and falls can also cause back and shoulder injuries. Be aware of hazards such as potholes, curves, stairs, wet surfaces, or hoses on the ground. Remember, slips and falls can be prevented. Preventing back injuries isn't difficult, and it doesn't take a lot of time. What it does take is a personal commitment on your part. Stretch your muscles before your shift, periodically throughout your shift, and after any breaks, lunch, or other downtimes. When you do lift, think about how to best lift safely and follow the procedures outlined in this video to the letter. Safe lifting and back injury prevention are really up to you. It takes 30 days to form or change a habit. The way you lift is a habit. So, it is most important to conscientiously focus on how you lift each and every time you do. Remember, it's your back, and you have a choice. Take the health of your back seriously, or take a chance. Make the right choice.